Hi everyone, from today's video I am going to explain you about drugs acting on cardiovascular system. This is the part 1 of the cardiovascular system drugs. So what are the drugs acting on cardiovascular system? They exert their action on the heart or blood vessels in a direct or indirect manner. Examples are anti-arrhythmic drugs, anti-hyperlipidemic agents, antihypertensives and anticoagulants and antithrombotics. From this video, I will explain you about anti-arrhythmic drugs. So, what is arrhythmia? Arrhythmia is any variation from the normal rhythm in the heartbeat. Arrhythmia can be caused by disturbance in the conduction of the impulse through the myocardial tissue, disorders of impulse formation and combination of both of these factors. So, antiarrhythmic drugs are the drugs that are capable of reverting any irregular cardiac rhythm or A to normal. There are some synonyms for antiarrhythmic drugs like antidysrhythmic drugs and antifibrillatory drugs. Antiarrhythmic drugs are classified based on their mechanism of action or pattern of electrophysiological effects produced on heart tissues. There are 4 classes. 1. Membrane depressant drugs. 2. Beta-adrenergic blocking agents. 3. Repolarization prolongators. 4. Calcium channel blockers. Let's discuss one by one. Class 1. Membrane depressant drugs. They shift membrane to more negative potentials. Mechanism of action of these medicines. They bind to the sodium ion channel and block the sodium ion channel function. After that prevents sodium ion conductance as long as the drug is bound. Prototypical drugs for this class are quinidine and procainamide. Based on quantitative rates of drug binding and relative dissociation from sodium ions, membrane-stabilizing antiarrhythmic drugs can be subdivided into 3 types. Class 1C. They are most potent sodium ion blocking agents of the Class 1 antiarrhythmics. They have slow dissociation from the sodium channel and slowing of the conduction time of the impulse through the heart. The examples for this category are ancanide, lorcanide and merisazine. Class 1B drugs are dissociate rapidly from the sodium ion channels and have lowest potency among membrane depressants. Lidocaine, tacanide, mexiletine are examples for this class. Class 1A drugs have intermediate rate of dissociation from sodium ion channels and have intermediate potency. Quinidine, procainamide, disopyramide are examples for this class. Let's discuss about quinidine sulfate. This is the structure of quinidine sulfate molecule. It is extracted from the bark of cinchona tree and similar plant species. It contains a hydroxyl methyl group that serves as a link between a quinoline ring and a quinucleidine moiety. As well as it has 2 basic nitrogens and quinucleidine nitrogen is the stronger base. Quinidine sulfate binds to sodium ion channels and decrease the entry of sodium ions into myocardial cells. Quinidine sulfate depresses phase 4 diastolic depolarization and thus decrease the transmembrane permeability. Therefore, the action potential duration is increased. This caused a reduction in sinoatrial node impulse initiation and depression of automaticity of ectopic cells. Quinidine sulfate used to treat supraventricular and ventricular arrhythmias including atrial flutter and fibrillation, and atrial ventricular premature beats and tachycardia. The next example is procainamide. This is the structure of procainamide. It shows same cardiac electrophysiological effects as quinidine. It decreases automaticity and impulse conduction velocity and increases the duration of the action potential. Procainamide used to treat atrial flutter and fibrillation, and atrial and ventricular premature beats and tachycardia. As well as it available as procainamide hydrochloride. Next example is disopyramide. This is the structure of disopyramide. Electrophysiological effects of disopyramide are similar to quinidine and procainamide. Phase 4 depolarization and conduction velocity are decreased by disopyramide. It contains the ionizable tertiary amine and formulated as a phosphate salt. Administered as both orally and intravenously. Used to treat life-threatening ventricular tachyarrhythmia. Next example is lidocaine. This is the structure of lidocaine. It is formulated as a hydrochloride salt. It binds to inactive sodium ion channels and decreases diastolic depolarization and prolongs the resting period. Intravenously administered drug and used as a standard parenteral agent for suppression of arrhythmias associated with acute myocardial infarction and cardiac surgeries. Next example is phenytoin sodium. This is the structure of phenytoin sodium. It is a hydrantoin derivative. It depresses ventricular automaticity and prolong effective refractory period relative to the action potential duration. It decreases the force of contraction, depresses pacemaker action, and improves atrioventricular conduction. Used for the treatment of digitalis-induced arrhythmias. Next one is tacanide. This is the structure of tacanide. It is an analog of lidocaine. Tacanide binds to inactive sodium ion channels and decreases diastolic depolarization and prolongs the resting period. It is orally administered drug, formulated as hydrochloride salts and used to treat and prevent ventricular tachycardia. Next one is mexiletine. This is the structure of mexiletine. It contains an acylyl moiety. Mexiletine formulated as an orally active hydrochloride salt. Used for treat to life-threatening ventricular arrhythmias. Generally, mexiletine is not used with lesser arrhythmias due to proarrhythmic effects of this drug. Next example is enconide. This is the structure of enconide. Enconide is a benzanilide derivative containing a piperidine ring. It blocks sodium ion channels, depressing the upstroke velocity of phase 0 of the action potential and increasing the recovery period after repolarization. As well as it blocks the delayed potassium ion rectifier current. It contains a terminal tertiary amine and is formulated as a chloride salt. It used to treat to life-threatening ventricular arrhythmias. Next example is lorcanide. This is lorcanide structure. It is a benzamine piperidine derivate. It slows the conduction in myocardial tissue and reduces the speed of depolarization of myocardial fibers, reduce impulse conduction in heart. This is an orally active hydrochloride salt. Metabolism of lorcanide yields norlorcanide. Used to treat for ventricular arrhythmia, ventricular tachycardia, and Wolff-Parkinson-White syndrome. Next drug is maricezine. This is the maricezine structure. It is a phenothiazine derivative. It decreases the speed of cardiac conduction by lengthening the refractory period and shortening the length of the action period of cardiac tissue. Used to treat life-threatening ventricular arrhythmia and formulated as a hydrochloride salt. The last example is propafenone. This is the structure. It has a direct stabilizing effect on myocardial membranes, that manifests in a reduction in upstroke velocity of the action potential. It decreases the fast inward current carried by sodium ions. It prolongs the refractory period, reduces spontaneous automaticity, and depresses triggered activity. Used to treat for paroxysmal atrial fibrillation, flutter, paroxysmal supraventricular tachycardia, life-threatening ventricular arrhythmias. Okay, let's discuss about second antiarrhythmic drug class. It is beta-adrenergic blocking agents. They show membrane stabilizing or depressant effects on myocardial tissues. The mechanism of action of drugs in this class is uncertain. Antiarrhythmic properties are mainly caused by inhibition of adrenergic stimulation of the heart by the endogenous catecholamine. The principal electrophysiological effects of the beta-blocking agents manifest as a reduction in the phase 4 slope potential of sinus or ectopic pacemaker cells. Nature of the aromatic ring and its substituents that is the primary determinant of beta-antagonistic activity. First example is propranolol. This is the structure of propranolol. It is non-selective beta-adrenergic blocking agent because of the substitution pattern on its aromatic ring. During the action the chronotropic, ionotropic and vasodilator responses to beta-adrenergic stimulation are decreased. Membrane stabilizing activities are shown by this drug. Propranolol used to treat for atrial fibrillation. Next example is nadolol. This is nadolol structure. It is non-specific beta-blocking agent. Slowed heart rate, decreased atrioventricular nodal conduction, increased atrioventricular nodal refractoriness are electrophysiological properties shown by nadolol. used to treat ventricular arrhythmia. Next, anti-arrhythmic medicine class is repolarization prolongators. Repolarization prolongators produce their effects by different mechanisms. They block ion channels and may be selective blocking or non-selective blocking. All class 3 drugs have one common effect, that of prolonging the action potential, increases the effective refractory period, do not altering the depolarization or the resting membrane potential. First example for repolarization prolongators is amiodarone. This is the structure for amiodarone. It is a benzofuranyl derivative with a central diiodobenzyl substituent and an alkylamine side chain. It prolongs the duration of the action potential and effective refractory period. As well as it shows minimal effect on resting membrane potential. Amiodarone displays non-competitive alpha and beta adrenergic inhibitory properties. Amiodarone used to treatment of life-threatening recurrent ventricular arrhythmias and atrial fibrillation. This is orally available medicine and formulated as a chloride salt. It contains 2 iodine substituents, and has effects on thyroid hormones. Next example is sotalol. This is the structure for sotalol. Racemic mixture of L and D sotalol isomers considered as a class 3 agent. It inhibits the rapidly activating component of the potassium ion channel current. It is used to treat and prevent life-threatening ventricular arrhythmia and supraventricular arrhythmia. This is an orally administered medicine. Next example is beryllium tosylate. This is the structure of beryllium tosylate. It is a bromobenzyl quaternary ammonium salt administered by intravenous or intramuscular injection. Mechanism of action of beryllium tosylate is uncertain. It does not suppress phase 4 depolarization, whereas prolongs the effective refractory period. Adrenergic neuronal blocking properties are cause for its antiarrhythmic activity. Used to treat for ventricular fibrillation and ventricular arrhythmias that are resistant to other therapies. Next example is tracetylide. This is the structure. Tracetylide blocks potassium ion channel receptors. It prolongs repolarization through other mechanisms. Used to treat atrial flutter. Orally and intravenously can be administered. Next example is dofetilide, and this is the structure of dofetilide. It prolongs repolarization and refractoriness without affecting cardiac conduction velocity. They are selective blocking agents of the delayed rectifier potassium ion current. It does not inhibit sodium ion channels or beta-adrenergic receptors. Used to treat for supraventricular tachyarrhythmia, atrial fibrillation and atrial flutter. Orally administered drug and formulated as a hydrochloride salt. Next example is azimilide. This is azimilide structure. It blocks both the slow activating and rapidly activating components of the delayed rectifier potassium ion current. It containing both imidazolidione and piperazine moieties. Azimilide used to treat for atrial flutter, atrial fibrillation, and paroxysmal supraventricular tachycardia. Last example for repolarization prolongators is abutylide. This is the structure for abutylide. It blocks both sodium and potassium ion channels. It prolongs repolarization of cardiac tissue by increasing the duration of the action potential and effective refractory period in cardiac cells. Can be used in treatment of atrial flutter and atrial fibrillation. Administered as intravenous injection and formulated as a fumarate salt. Next anti-arrhythmic drug class is calcium channel blockers. All calcium channel blockers don't show anti-arrhythmic effect. Only some calcium channel blockers show the antiarrhythmic activity, such as verapamil, diltiazem, pepridil. They block slow inward current of calcium ions, voltage-sensitive channel, during phase 2 of the membrane action potential in cardiac cells. They have ability to block sodium ion channels also. They decrease sinoatrial node automaticity, depress myocardial contractility and reduce peripheral vascular resistance. The first example for calcium channel blocker is verapamil. This is verapamil structure. Verapamil blocks the influx of calcium ions across cell membranes. Blockade of calcium ion channels, which inhibits the influx of extracellular calcium across the cell membranes. Activity of verapamil is voltage dependent and frequency dependent. Verapamil rapidly metabolized to at least 12 dealkylated metabolites. Used to treat for supraventricular arrhythmias including atrial tachycardia and fibrillations. Administered as both orally and through intravenous injection and formulated as a hydrochloride salt. Next example is diltiazem. This is diltiazem structure. Diltiazem is benzodiazepine derivative. It inhibits the influx of calcium ion during the depolarization of cardiac smooth muscle. It decreases atrioventricular conduction and prolongs the refractory period, prolongs atrioventricular nodal refractoriness and exhibits effects on atrioventricular nodal conduction. Diltiazem used to treat for atrial fibrillation or atrial flutter. Diltiazem can be orally or intravenously administered and formulated as a hydrochloride salt. The last example for calcium channel blockers is Bepredil. This is the structure for Bepredil. It inhibits the transmembrane influx of calcium ions into cardiac and vascular smooth muscles. It slows the heart rate by prolonging the effective refractory periods of the atria and ventricles, and the refractory period of the atrioventricular node. Used in treating atrioventricular reentrant tachyarrhythmia and atrial flutter or fibrillation. Bepredil is an orally administered medicine and formulated as hydrochloride salt. There are some miscellaneous anti-arrhythmic agents which cannot be included into above classes. We will discuss about 2 examples. First one is adenosine. This is adenosine structure. Adenosine reduces sinoatrial node automaticity, slows conduction time through the atrioventricular node, and can interrupt re-entry pathways. Used to treatment for paroxysmal supraventricular tachycardia, including Wolff-Parkinson-White syndrome. It is intravenously administered drug. The last example is digoxin, and this is the structure of digoxin. Digoxin is a cardiac glycoside. It inhibits sodium-potassium ATPase enzyme and it results in an increase in the intracellular concentration of sodium ions and calcium ions and a decrease in intracellular potassium ions. Phase 4 of the action potential becomes more positive, which in turn reduces the height of phase 0. Conduction rate in cardiac cells is slowed. Sinoatrial node discharge and atrioventricular node conduction are slowed. Digoxin used to treat and prevent sinus and supraventricular fibrillation, flutter, and tachycardia. Digoxin available as both oral and intravenous injection. Okay, these are the things to discuss about anti-arrhythmic agents. Please let me know as a comment, if this video was important for you. Please subscribe my YouTube channel and like, comment, share this video. Okay, we will meet with next video soon. Bye.